Let me tell us one of the reasons why we have more complications from cesarean section delivery in this part of the world. As against the white man's land, Europe, US, Australia, Canada, where they do more cesarean sections and their rate of complication is less. It's not because they have better doctors than African doctors, than Nigerian doctors. In fact, it is in the records that if you go to Europe today, if you go to Canada, if you go to Australia, if you go to the United States of America, the chances that the doctor that will attend to you is a Nigerian is very, 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 very high. But why do we have higher rates of complications, especially with our women? Make they come the pie from CS delivery. One of the reasons is because our women in labor present very late after untoward complications, grave complications has already setting in labor. Let me tell us a story. There was this woman who married, and immediately she married, she got pregnant. So by about the 10th month, she was due for delivery. Funny enough, we were told reliably by her husband and those who brought her into the hospital that she never attended any antenatal. She was going to the mountain top to meet one prophet. She was on this mountain top on this fateful evening when she went into labor. So it means that all through pregnancy, there was no antenatal care in a standard hospital or clinic setting, not even the primary health care clinics that we have in our rural areas. Blood pressure was not checked, her urine was not checked, sugar was not checked. She probably, before marriage, didn't even know her genotype or her blood group. These are some of the issues. She probably did not know if she was carrying a baby or a set of twins or a set of triplets. I don't have information if she eventually or at all even went to do a scan to know the well-being or to ascertain the well-being of her baby. She went into labor on the prayer mountain. And of course, because we have faith-based delivery homes around that place, they attempted to take her delivery. By the time, after close to 24 hours, that she came to the hospital, that church members and her husband brought her to the hospital, the baby in her womb don't pie. She already had kidney failure. Liver enzymes had already become deranged. So it means that apart from kidney failure, she had liver damage alongside. She was brought in labor unconscious. We eventually did a cesarean section to bring out a baby we don't pie. But because she was very, very unconscious, she was not stable, we could not keep her with us eventually. We sent her to the teaching hospital that was the nearest tertiary health care center that could take care of her. Unfortunately, she pie for ICU. She pie for intensive care units. She pie, a baby pie, and we had to do an emergency CS to bring out a baby we don't pie. Many, many more other complications that could arise: postpartum hemorrhage, that is PPH, infection of operation site after surgery, having a baby with cerebral palsy, having a baby with meconium aspiration. Meconium aspiration is this baby we don't shit for inside the mama belly during the course of labor because there is fetal distress. Baby shit for your mama belly, the baby can't chop the shit enter the lungs through the nose. Those are some of the things. We have baby with, all manner of complications. So please, the healthcare setting is there for a reason. Once you get pregnant, in your first trimester, if you got pregnant easily, there is nothing to worry about. Make sure that you start antenatal care as early as possible, around 10, 11, 12 weeks. Start antenatal. But if you have a bad obstetric history, you've gotten pregnant with nothing to show for it, you've gotten pregnant but you want to have a baby, you're having stillbirth, ectopic pregnancies, premature deliveries, and all of those things. For this group of people, once you get pregnant, please go and register for antenatal care immediately and make sure that you attend all of your antenatal classes. Like I would usually say, what you want, what your husband wants, what your family wants, what the society wants, what we want as healthcare providers is that at the end of the day, irrespective of the route of delivery, mother and child should be alive and well, not just alive. You should be alive and well. And irrespective of the challenges that may come your way as a pregnant woman during pregnancy, we also want you to have an exciting, as much as possible, an exciting pregnancy journey. Again, this is me saying cheers to every pregnant woman out there. A word is enough for the wise. Once you get pregnant in your first trimester, go register for antenatal care. Do not go to the prayer mountain to deliver. Do not go to the faith-based home to deliver, except the faith-based home is the only close-by place to you where delivery can be conducted. And we must even be sure that the traditional birth attendants in these faith-based homes, these traditional midwives, are those who have some form of training from doctors, from midwives, from government establishments. I would see you in the next video. Cheers and bye for now.